me a second. Okay, my name is Heun. I'm a consultant psychiatrist, professor of psychiatry, and editor of Global Psychiatry Archives. And it's my great pleasure today to invite Dr. Janardan from India, talking about an overview on dementia.
Thank you, Dr. Reiner, for having me here. I will be talking about dementia. So, what is dementia? Is not just a one condition; it is in fact a syndrome or a group of conditions that characterized by progressive decline in the memory or decline in the cognitive ability function that interferes with day-to-day life. It affects memory, thinking, problem-solving skills, even the behavior. So most common types of dementia are Alzheimer's dementia that we have seen. I think we will be knowing about from the movies and other thing, other sources. So the most common dementia the symptoms are like memory loss, difficulty in communicating, and disorientation, poor judgment, or change in mood and behavior. These symptoms usually worsen over the time and making it harder for the individual and in fact they are the caregivers to function independently. The exact cause of the dementia is not known, but there is a progressive damage to the brain cells which affects the ability to communicate. Different types of dementia are associated with different causes. Like vascular dementia are associated by like atherosclerosis, hypertension, or or smoking, lifestyle changes like smoking and excessive alcohol intake. So dementia and like Alzheimer's disease, this is linked to the plaque, like tau proteins, tangle, and the tangles that present in the brain, and other like Lewy body dementia associated with the abnormal protein deposits in the brain. Risk factors include aging, genetics, blood pressure, lifestyle changes, and smoking, poor diet, and lack of exercise. There are also nutritional deficiency dementia also, like and other dementia like that, but that come into the reversible cause of the dementia, like HIV related dementias. It is associated with disease and alcohol related dementias, or like thiamine or other vitamin B complex related dementias. So dementia is not just I told in my previously, that it is not just a one symptom. It is a group of disease. It affects the cognitive ability. It not only affect the person to live his life steadily, but to an extent to his caregiver also. So what are the like how we deal with this dementia, and what are the treatment or what are the managements available in the, while there is a no cure or no exact cure of the dementia, there are only the symptoms can be managed. Medication like cholinesterase inhibitor or or other like memantine or rivastagamine or donepezil. These are the some medication that uses to halt to the condition, not to halt to the condition, but to decrease the progress of the disease. Other things like cognitive therapies, healthy living, and supportive care are necessary. Early diagnosis is critical. If your loved one or someone is showing signs of dementia, consult a healthcare professional for an evaluation. Dementia is not only affects the individual but also affects the impact on the families and the caregiver. As the condition progress, individuals may require lifetime care, putting emotional, physical, and financial strain on the caregiver. It is important to seek support throughout the or and counseling and the support groups or respite cares. Fortunately, there is still a lot of stigma attached to the dementia. Many people don't understand the condition, and which leads to the fear and isolation. But dementia is a medical condition, not a normal part of aging. Something not to be ashamed of. Raising awareness and often compassion to those affected can make a huge difference in the life of the person. To sum up, dementia is a challenging but manageable condition. Early detection, the right treatment, and the support system can make a difference to the life of the person and the caregiver, and impact the quality of life. Is Let's continue to educate ourselves and break the stigma about the around the dementia.
Right. One question is, if I am a carer of someone with dementia or something, I'm not totally sure. So what should I do? So what's the best way of dealing with that if I
I
have
think
such
better
issue?
in such cases better to go with healthcare professionals like mental health care, maybe neurologist or psychiatrist, whoever like approachable, so that seek the support of that. It is a medical condition, so better to treat and what they best can offer it to you.
So sometimes people say there is some mild cognitive impairment. So when is it
Some
when does things go from a mild cognitive impairment to dementia? So where is the threshold?
Generally mild cognitive impairment to dementia, that is like I think I'm not very sure about that, like that is 5-year period, like changing to MCI to the dementia. But not every person go from MCI to convert into the dementia, mild cognitive impairment to dementia. So it takes time converting, but person should be, not every person who is suffering from mild cognitive impairment can turn into dementic patient.
Some people die of dementia. How long does it take, So is it a fast disease, or is it something which takes long, or is it depending on the different types of the disorder or the causes? So what's the time course?
Actually, dementia itself, nobody dies from the disease dementia. So but the problems it cause, the person dies because of the other problems he face, maybe because of the like injuries, like, and during the, because this is like behavioral changes also. So generally, the dementia is not itself a like it's a deteriorating cognitive ability losses, but it is not lethal in that sense that person does not die from the disease itself, but from the complication of the disease, a person dies.
Okay, thanks